Hello there and welcome again. This is our training tube from Module 1 and today we'll be discovering about the clock drawing test. Why do we need to know about the clock drawing test? Well, it's easy. It's a quick assessment to analyze the neurological dysfunctions for those with dementia that give you a quick assessment. You can find out if you have the right parietal or the right hemisphere damage in under 2 minutes. So let's go ahead and see what this is all about right now. So once again, we are covering scientific foundations, training two. All right, this is our roadmap. We already covered training one, the cerebrum. Now we're moving on to training two, which is the clock drawing test. All right, what is it? Well, it's simple. The clock drawing test is a quick and effective tool to screen individuals for signs of a neurological issue. We're screening those with dementia, Alzheimer's, right? So it's so effective that we use in practice often. It can be done under 2 minutes. And the performance of this task can give you a little bit of insight of which brain damage the patient has suffered. For example, it can indicate the right parietal or the right hemisphere's damage. So they are the same. Right parietal is the same thing as the right hemisphere. Remember, the parietal has to do with the reading, writing, and and tasting, right? So damage there on the drawing clock is equal to the right parietal, the right hemisphere, and this is how you can remember. I use the acronym D Dr. Hem. So that's damage right parietal lobe or operations within that are assessed, right? The OR, assessed operation rooms. The R is for the right, okay? And hemisphere. For example, when we're citing, talking about the clock drawing test, we're asking the patient to draw a clock with the numbers, right? It can indicate what deficiency is the patient suffering. For example, we ask them to do the numbers set from 10 past 11, right? Check if the patient accurately places the numbers at the hand of the clock. If the patient struggles or fails to draw certain element correctly, it may indicate impairment related to the dementia, and oftentimes that is the right parietal. Okay, once again, let's remind ourselves of the key points about the clock drawing test. It is easy to administer, 2 minutes. It evaluates the right hemisphere health, tests the patient's right hemisphere's functioning. If they cannot do it, it is a probability or probably caused by a problem in the right side of the brain. And once again, it is easy to assess and give this test. Here is what it looks like, right? So if you see here number 4, right, it's a moderate visual disturbance, disorganized. So the numbers are not quite in the right place, right? And that gives you examples. If we look at number 6, right, you can't really say this was a clock, right? So it would be more like towards of a severe type of Alzheimer's or psychotic, for example, or severe depression or psychotic uh, states. Basically, they didn't even try here, right? So no attempt at all. No, doesn't look like a clock, right? Write the words or name there. right? Severe dementia would be kind of on the number 5 because they did attempt, but it's very confused, right? Disorganized. And that is it for this quick training, 5 minutes. Hopefully, a question similar to this may come up on your test. You know, the right parietal, the right hemispheres is indicative of the clock drawing test, can be done under 2 minutes, and is easy to assess the patient for Alzheimer's and dementia. My name is Dr. Lopez, and I'll see you on the next module. Thank you.